We are live.
Are we live?
We are live.
Well, I tell you, we almost had a little issue again with Facebook, but we got it rectified. Good evening, everybody. Happy Easter Eve. How's it going, Charlie?
How you doing, Mel? Doing fine. Yes. Happy Easter Eve, everybody.
I'm
We hope you
hearing you a
folks
little soft, Charlie. You're a little soft. I don't know why.
Am I? I mean, I hear you loud and clear.
Okay. I don't know. Maybe I'm just getting deaf. Anyway, everybody, welcome again on Saturday night. Tonight, as you know, we have Senators Kouchi and Donovan Dela Cruz. They'll be coming on very shortly. Let me share this thing out so real quick while we're waiting. How's your day going, Charlie? How's your day, buddy?
Well, today I had some good times. I had a lot of people. We had a nice conversation. I did a post today, and for the first time, I did a solo. I sang a solo song, and I had to make sure that I wasn't losing the touch there, because I haven't been playing with the guys for some time now, or performing with them at the Kalahio or at Troy's. So it was just one of those things, boy. It was kind of, I call it a spooky run. So, but it was nice, and I thank all the people for their compliments. Was nice.
It was really nice. And I heard it, and we put them on our Alexa speakers so the whole house could hear it.
Oh, thank you.
She's coming in the door right now. I just let's just wait for him to pop in here. Oh, I don't know what happened. Oh, there he is.
Hello, there he is.
There he is. Senate President Ron Kouchi. Thank you, sir.
Hello, Mel and Charlie.
Hey, right. Ron. Senator,
welcome back. Welcome back. I think you're the first repeat guest we've had.
Yes.
Well, this is my. The other time you just sent me an email because you saw my name, so I guess the first time I came on didn't count. Though. Like 10 or 15 minutes.
That's right.
Not that I'm counting.
So anyway, Ways and Means Chair Senator Dela Cruz will be on shortly. Just I'm wearing my Walk MS shirt. I think, is it backwards?
No,
Is it straight?
No. Yeah, it's straight.
Okay, when I look, I guess it's reversed on my screen, but today we had a virtual MS walk. Every year we get together, everybody, and we do the MS walk at Kapa'a. We go down the bike path, and because of COVID-19, because of the pandemic, we did a virtual walk today. So everyone went out, did their walk, took a picture with their shirt, and posted the pictures. So we've seen quite a few. I'm hearing an echo now. I don't know what's going on.
No, that was me because I'm trying to get Facebook on the computer, and when I went large screen, the mute automatically switched off.
Oh, perfect. So you'll get to see the comments as they roll in. Huh? So yeah, it was great. I believe we had a lot of participants. I know we didn't raise as much money as we usually raise for the awareness and research, but totally understandable considering the circumstances everybody's going through right now. But it was a nice day. Patsy and I went out in the sun, checked it out, took our photo, and we hope we can raise awareness of MS. As you know, two of my brothers and my sister, all three of the four of us have been diagnosed with MS. So it's kind of scary. But anyway, here comes the Senator Dela Cruz will be coming in.
Well, today
there he is. He's sideways.
Oh, well, wow, what can you
There we go. Much better.
Okay.
You had about 25,000 people just turn their heads just to see you, Donovan. Can you hear us?
Yeah. How's it going?
All
Good.
right. Hear you. Perfect. Okay. Well, thank you, two gentlemen, for joining us. We're coming off one more death today, COVID. A woman in Honolulu Kauai still maintaining it at 19 cases, which is a good thing. Statewide, 21 additional cases. So, you know, it is what it is. We got some rough times ahead, and we welcome you guys on board tonight. We got a bunch of questions that we'll take at the end, but really what I wanted to do, and we'll get out of you guys' way. We just wanted to have you guys share, give us some updates of what's happening legislatively. A lot of the questions are surrounding unemployment, the processes about the testing. If you guys know anything about if the testing and how people can get tested, especially on Kauai. I know, Senator Dela Cruz, you're from Oahu, but we got guys on Honolulu. We got guys on every island watching this tonight. So without further ado, Senate President, you want to take the lead on this one?
Sure, and it'll just be a short lead. As we were talking before Donovan got on, I've had the chance to be on. I really reached out to Donovan if he'd be available when Mel was telling me he didn't have any scheduled guests for tonight. As soon as we had recessed the legislature on Monday, the 16th of March, we had a leadership meeting the next day, and Donovan approached me and he said, I know that the neighbor island members are heading home, but I do have some members who, are ready to roll their sleeves up and get some work done who are going to be here. And he had asked about creating a COVID-19 special committee of the Senate. And so that's how we got Senators Morawaki, Kim, Kidani, Keohukalole, Favela, and Donovan as the chair. And these have been broadcast live on Olelo. I believe Hoiki is carrying it. For a while, we had it on YouTube, but there were some concerns raised that the YouTube feed could not have captioning. And so that's why the last meeting was back on Olelo. Then we've had KHON carry the meetings live as well. It's turned out to be a great source of information for members in the community. I had talked to Senator Dela Cruz a few, toward the end of the previous week and said, well, maybe, this committee should be working towards wrapping up. And there are still more questions that have come up, and there's more and more viewers. And so I had to apologize to him on Thursday and said, well, I guess you were more correct than I was. And so he's got a full slate scheduled for next week as well. And with that introduction, I'll turn it over to Senator Dela Cruz. And I just want to say, Donovan used to represent or come and represent the Kauai Visitors Bureau when he was in the private sector. When he was a council member, he was regularly here, as you know, Mel. And every year since 2010, when we got elected, he has come to Kauai, and he's made it a point not just to hear about what's going on Kauai, but to come boots on the ground and see firsthand what's been happening on Kauai. So he's really been a great advocate for all of the neighbor islands, but especially with only one member from Kauai, he's been just a great partner to have, and he has been wonderful in supporting the Garden Island. Senator Dela Cruz.
So thank you guys for including me and inviting me. So the committee has been working for about 3 weeks. The major issue, Mel, is something that you brushed upon was currently unemployment, and they're really short in getting staff there. I don't think anybody would have anticipated the kind of load that they have now. I guess the committee's frustration is that there's about 706 employees right now that are non-essential, and they're not teleworking, and we wanted them to be reallocated and redirected to Department of Labor so that they can go ahead and help with the hotlines, the phone calls, answering questions. The Senate was about to send over 40 people, maybe about early last week. And so the Senate clerk organized a training manual. She had people ready to go. And unfortunately, the governor's chief of staff thought that she'd rather have a different direction. So unfortunately, they've been short still for about 2 weeks, about 57 people. On Monday, Department of Human Resources and Department of Labor is supposed to let us know if they actually got more people there. We know there's about 50 librarians. So because libraries are closed, there's about 50 librarians that are going to go and help Department of Labor with unemployment. And the libraries have even said that they'll allow some of the libraries to be used as call centers because there's just not enough space currently at Department of Labor, and especially with the social distancing, they got to come up with new ways and new areas so that we can keep people safe when they help with unemployment.
Donovan, real quick, can I interject real quick? I had read that they were looking at bringing back 80 retired employees out of retirement to assist with the unemployment overload. Is that true? And the rumor was that the unions, there was some issue with the unions to transfer these workers from one job description to another. I read that somewhere. I can't remember where. Does that sound familiar to you?
No. So, I mean, we haven't heard that they're going to bring back retirees, but what we have heard directly even from the union, the union issued a press release last week that they've already communicated to DHERD that they approved the transition for employees to move from one department or the other. So it's really stuck right now on the chief of staff's desk. Once she gets that approved, then hopefully DHERD can move those people over. So we don't want people to think that that's a stumbling block. I know at the last hearing, DHERD said that they're still in negotiations, but that's not true. HGA already signed off saying, yeah, you know what, we got it, whatever it takes to keep the state running and provide the best services. So the union has been fully on board on whatever we have to do to move employees around to different departments.
Donovan,
that is why we want you guys here, because you can, dispel all the rumors that are floating around. Thanks for that explanation.
Part of our concern was maybe our employees weren't accepted because there might have been union issues. And so I did call Randy Pereira on Monday, spoke to him personally, and he knows how important it is to get the checks out there to the people of Hawaii. And again, as Senator Dela Cruz has mentioned, he's fully committed to making the plan work, redeploying employees to get the checks out as quickly as we can to employees. The other thing that the Attorney General said when I checked with her on Monday, if an employee would like to voluntarily go, like the library employees have voluntarily gone, as Senator Dela Cruz indicated, then that's also fine if the employees are voluntarily going in there. So hopefully with this reassignment and with the volunteerism from the library employees, we're going to be putting between 80 to 100 additional people starting Monday.
Okay. Well, Ron, let me ask you real quickly. Mel stepped away from the camera, so he has control of who's up on first and second. So I'll direct this to you. I can now, since Mel is back, I'll direct it to either Donovan or you, Ron. But my question is, prior to this pandemic hitting the state, and the state is pretty much at this point where it looks like they really didn't know what they're faced with. Is it safe to say that they really don't have a number count of how many people are employed in the state? Because should something like this wrap up one more time, I mean, what, are they going to get caught off guard again? Or, I mean, I'm pretty sure they should get an answer now, because based on the number of claims coming through, that they should have a kind of a good general idea of how many people workforce the state has. But it almost seems that prior to this pandemic,
are you talking about the state employee workforce or workers in the state of Hawaii?
Workers in the state of Hawaii.
Well, they should have a good idea, but again, the one challenge is we know how many legal workers there are here who are filing and paying their taxes. Okay. Because we do process all of the taxes, or as long as they're on certified payrolls getting that information reported to the Department of Taxation. So we've always known that technical number. I don't think there are people who work for cash and other means, and there's no way that we're ever going to know who those employees are. But that other number is available through the Department of Taxation.
Well, I just brought it up because I have one question here that it seems like the Department for Unemployment, I guess the claims, they were so overwhelmed. It was just like a tidal wave that hit them one time. So and the person who messaged me on that.
No, but the normal amount that they would process is maybe 1,200 in a week, and then they had 160,000 come in, and so for the computer system, that was a load that exceeded what we could handle and crashed the system. So they had to add 2 new servers. They had to upgrade the broadband capability with the enterprise technology services, and now even with all of that, they can't keep up, and they now need to stand up call centers. When I did talk to Randy Pereira, though, he has been in communication with his members who work at DLIR, and one of the problems is that people are rushing when they get in. Finally, they want to get paid, they go through it, and then when they hit send or finish, there's quite a few of the applications that is actually missing information, whether it's the street address, whether it's a phone number, a birth date. But that's all part of what these additional employees can do, is go get these unfinished applications, to call them up and say, hey, guess what? This is a box you haven't filled in. Get that information filled into the boxes, and then get that application going through the process.
Okay.
Let me just tag on to that, because a question just rolled up, and we talked about it last night with Congresswoman Gabbard. The extra $600 a week that is coming with the new funding bill out of DC. They were saying that they were having some problems working with the system to pay that out. Have you heard anything about that as well?
Yeah, so the director said that they have to upgrade the system. So they're going to have to, I guess, manually do it until they can get the upgrades, which is why the only way we can deal with the amount of claims right now and all these new additional, I guess, check boxes would have to be, we got to get more people in there. That doesn't mean we're not going to be asking the administration to upgrade the system simultaneously, but you can't, just because of the sheer volume, the current staff has to work on getting it out. And then we got to supplement that to kind of upgrade and modernize the system as soon as possible. But I think Charlie was correct that, we haven't modernized government. We haven't modernized the system. And this is going to force us to have to do that finally, which probably is long overdue.
Okay. And then one last question on the unemployment that I have. I'm not sure if Charlie has any, but it's regarding the Micronesian community. They're having issues with the website, and Palau, Marshall Islands, and the Federated States of Micronesia are not able to apply with the new website. You guys, have you heard of that as well?
No, but we can follow up. We can try and ask.
Apparently, when they did the new web form, they left out that COFA group. So yeah, if you guys could check on that, I'd appreciate it.
Okay.
So any more unemployment questions?
No, I'd just like to say, I'd like to thank Senator Dela Cruz. He came up in November with an entourage of Ways and Means to take a look at the farm to school program. They visited the different farms here on Kauai, as well as businesses. And we are so thankful, and we're proud of, the program is taking off. It's the pilot project is doing good. So I'm very thankful. I wanted to thank you, Senator Dela Cruz. I never had the chance to personally thank you, though I was on a honeydew list that day with Stephanie, and I was doing things that usually husbands don't do in public, but I was doing it. I was being a good boy that day.
No, I appreciate that. I mean, you know, Kauai actually, because of the way it's organized, it's a small knit community. You guys seem to be able to get things up and running a lot faster than other areas. So that's really impressive. And the rest of the state can follow some of these models.
Thank you.
All right, let's
You know,
move on.
But Mel, before you ask Senator Dela Cruz another question, maybe if you could just tell them what's coming up next week, and then if their question doesn't get answered, but they're you know, that might be someone who's appearing before the committee, then they would know if they can't watch it live because it's going to be running between 11 and 2:30. It does get taped and recorded. It does get posted up, but you may want to share that, Donovan.
Okay, so on Monday, we're going to hear from the governor's chief of staff, just because a lot of things seems to be on her desk. We're also going to hear from DHERD, Department of Human Resources, to make sure that those positions got moved. We're also going to hear from Department of Transportation on the airports and the harbors, making sure that some of those things that they were tweaking are hopefully finalized. And we're going to ask the AG to appear because there's a lot of legal questions that people have. Department of Taxation is also going to present. Even though they focus on taxation, they're working on my understanding is some kind of tracing app. So we want to hear from them. Of course, we're going to hear from Department of Health. And on Wednesday, we're going to have a briefing from HIEMA to talk about our overall strategy from now on, because I don't think COVID is going to end overnight. And even when it is settled down, how is government going to operate? So we're going to have meetings on Monday, Tuesday, and Wednesday.
Okay.
And for those of you can go to the Capitol's website, and there's a link for Senate hearings. There's a link for House committee hearings. If it's live, as Senator Dela Cruz said, you can see it live between 11 and 2, but there's archived meetings as well. So if you want to go watch one that you missed, it's quite informative. If I catch it live, I do a watch party, so you can watch it on my page, but I don't always get to catch it live. I missed last week. So you can get to the archive and watch it. Like I said, and I really appreciate what the Senate is doing. I haven't watched many of the House committee meetings, but I have watched the Senate. And the senators are asking the right questions, and I really appreciate that. I want to tag off on that. Testing is another issue that we get a lot of questions about. I know we heard from Bruce Anderson and the governor's staff as far as the testing. It seems for us on Kauai, it seems that when we see the news and we watch the news on Honolulu, they've got a lot of these drive-through, drive-up testings all over the island, and we have one spot on Kauai. And what I'm hearing is it's still very difficult to get a test done here on Kauai. You know, you gotta have symptoms. You gotta have a paper from a doctor. Is that how it's done on Oahu, or is there drive-through
Yes.
if you work? It's
No,
the same?
again, the drive-through is the same way. You need to have symptoms. The first time they stood it up in Kaka'ako, people drove up expecting that they could just get tested, so they were disappointed. But when they stood up that testing at Ko'olau Ranch, because they have 400 employees, and they were concerned that the positive employee was in contact with numerous employees. They shared like little less than 20 of them shared a lunch space. And then when we had the situation at the Capitol, not everybody got tested. They asked you questions, they took your temperature, and if you showed some symptoms, then you went. And then there were several of us that were on Tuesday in a 2.5 hour meeting with Senator Nishihara, and most of the people who were involved in that meeting, it was determined that those people would be tested as well. So no matter what island, when you go to Kona, Hilo, in Maui, it's with the paper, or you need to be presenting some symptoms.
Can I also share that I think what we need, maybe when you're doing the questioning with the health department,
Yeah.
I mean, from the sound that I'm getting from right now is people see their PCP, right? and they got symptoms. So they can go to these testing sites. Where they're driving to the testing site, I don't think that anybody asking them, hey, before you coming to our site, did you stop anywhere else, or did you just come straight from home? Because I look at that is, if the test come back positive, this person from wherever they came from to the testing site just going to go do the thing and twinkle, twinkle, little star all over the place. You know what I'm saying? So I think
and
that
actually,
needs to be asked.
But Charlie, Bell can actually address that concern. The person coordinating all of the medical side is Lieutenant Governor Green. If you look, well, we have over 17,000 tests that we've run to date. I don't think that the Department of Health has hit 500 yet. The Department of Health has limited test kits, and they have the narrow criteria, and their primary concern is when there is a positive, to see all of that close contacts with the positive, and then their lab was the one that can turn it around in 24 hours or less, so they could get into finding out other areas. The bulk of the tests have been through the private medical doctors and what they've been setting up, and Lieutenant Governor Green has been coordinating that. So if you just pass that on to him, he can get that message out.
Okay, because I think with the recent explosion on Maui, right? And the general public does not know the full scope of how it occurred. But if you just look at numbers and they use, a lot of it is optics, right? When you give the news to the media, the first thing you talk about is cluster. Ooh, bad word, because why? When you associate the word cluster with amount of numbers involved, then that puts everybody into a tizzy. So instead of kind of calming people down, you just getting all riled up. So now you get people firing from all angles. So that's why they're going to ask these kind of questions. Yeah. I know one of the things that's very bothersome is when somebody tests positive and they go on quarantine. After the quarantine, they're good to go. They don't need retest. But yet you hear war stories up in the mainland that, hey, it was positive, they come back, the thing will re-emerge. So that's why nobody knows what to think. Is there a possibility it can be the virus itself re-emerges, I should say. So I think that's what people are looking at is there a definitive way that if I test positive, I do everything that you tell me to do, such as quarantine myself, and then on 14 days, is there any way I can get a secondary test to make sure, hey, I flatlined it? Or is there a possibility that, boom, the thing will pop up one more time? So I think those are the kind of questions people have been asking as well.
So my understanding is it's similar to the flu in that sense, where it probably could come back at some point if you're not careful. But one of the things that you're talking about is the contact tracing. And so Department of Health probably has about 20 people right now throughout the state that are calling and trying to trace back people's contacts, kind of like what you mentioned, where they were at, who they were with. At the last meeting, they said that they probably need to triple the amount of staff in that division. So we would need at least another 60 people so that we can get 80 people in that division calling and tracing all the right steps, as you mentioned, so that we can kind of get a hold of it. Because people may be asymptomatic, but they may not know that they have it. And by doing the tracing, we can try to identify that. We're just surprised that they didn't ask for the amount that
sooner,
the people sooner. So Director Anderson said that he's going to get back to us on what he thinks the cost is going to be for the 60 people. But with that said, going back to our earlier conversation with DHERD, a lot of that is just making phone calls and taking notes and trying to trace it back. So with the amount of people right now that the state has, we could probably redeploy people to help Department of Health with contact tracing. They just got to do it. They got to make sure that occurs quickly.
And then for the retirees, Charlie, actually, Director Anderson is the one that said that they are reaching out to retirees as well to get them to come back. They would know how to do the contract tracing. They have accelerated the medical students, the nursing students, to all get them graduated out in the field, those that were ready to go. So they've been utilizing some of those techniques that are being used in other jurisdictions to get more people in the health field. So they were the ones that are reaching out to the retirees to come back.
You know what I would like to see real quickly is, if it's possible, I know we posed this question to Lieutenant Green the last time he was on, is that, again, we asked, and for some reason they said it was a HIPAA thing, right, Mel? Came on as a HIPAA thing again, because we're not asking for a person's name, know where they live. But if they told me that there was a Kenny's Burger House, that's all they gotta say, and they put that information out that based, whoever tested positive was at the location, that person may not know me, so therefore he cannot refer my name as a contact. But if I was in the area, I think I can police myself and say, hey, he was there too. Wow, I better watch out now. Because if I start presenting symptoms, then definitely I was in that particular area. But because they don't put that information out, it's like a wild guess. You're rolling on dice and you just get what you get. And I said, maybe, they always ask in law enforcement, you're limited staff, but if you get extra eyes and ears, that can help. We can be that extra help if they just tell us where this person's been.
Yeah.
I think early on, the State Department of Health had conceded the fact that this was going to be unmanageable, and that, as far as I could tell, that there was no real effort put in to go after the investigations of these contacts. And the emphasis was placed on the social distancing. And I get that. I mean, of course, we know that. But without the investigations of the contacts, I think we fell behind. And now I understand it is becoming a priority. But my God, we're almost a month into this thing. And I think that is frustration. And I heard that at the conference, and I was kind of shocked. There's a question about, is there an Abbott machine available here in Hawaii, and have we gotten rapid testing kits yet? And, I don't mean to put you guys on a spot, just that you guys volunteered to come on. So we have Lieutenant Governor Green will be coming back. So I'll be asking the medical questions, but just if you folks know, if not, that's totally understood as well.
Well, I'm not sure if Department of Health has received them yet. I know that we're supposed to get 15 of them. I think each state is supposed to get 15 of them. But Department of Health, I'm not sure if they have obtained them already, and when they're going to start using them.
Yeah, they did receive it. The most important thing, though, that they were sharing, and this was talked about at the governor's Wednesday press conferences, they will only be having enough supplies or kits to do 120 tests a week so far. And the demand for the actual materials you need to do the test is high enough. So until we can get more, and they are trying to see if there are some of the kits available on the open market to expand beyond the 120 tests a week.
And as far as testing, Lieutenant Governor Green was on our show, and he said that we have the capacity, not with the Abbott, of course, not the quick response testing, but we have the capacity to test 1,500 COVID tests per day, and that he was really pushing for the what he called the intimate contact. If you live in the same house, you work in the same place, and somebody tests positive, he wants to see everybody tested, and that we have the capacity. And we'll ask him that when he comes back again, but that apparently not happening right now, correct?
They said Wednesday they were now going to start.
With the intimate,
the Lieutenant Governor, Dr. Anderson, and the governor met before we walked out to the press conference. And at the Wednesday press conference, the governor announced that we will now be testing close contacts. Whether they're asymptomatic or not, they will be tested.
Okay, and I know we all have heard the horror stories of people telling us that they went to go get tests, they were denied the test, even though they had come in contact with a positive carrier. So,
and you just need to watch the Donovan Dela Cruz show, and you'll know that the Senate members have not been very happy with the Department of Health as well.
That is why I have watched it, but I've known Senator Dela Cruz for a long time, and most people ease up when they get old.
Oh, shit.
And then let's head into the economy part, because I think
Yeah.
that we have a lot of questions about the economy. Well, let's start off with this one. This is a funny question, and I'm going to ask it only because it's. I just want to see you guys' reaction. Do you folks have any clout with the governor to have him send a letter to the president to stop the fights? That's a letter. That's a question came off the comments. Because I
Well,
think many tried. I've read the House version of the letter to get tough. I've read the Senate letter to the governor to get tough. And he came on his press conference and say he believes it's a waste of time to pursue
Yeah.
that, because he spoke to the FAA and they told him that they didn't want to do it. The bottom line is, why does he want to send a letter? Why doesn't he want to send the request?
You unfortunately you got to ask him. I mean, even the committee. I'm not sure. I'm sure you were watching on
Yeah, I did.
Thursday. Senator Kim is really quite upset the fact that that letter hasn't gone out, and Senator Keoho Kalole had mentioned, if the governor is not going to sign it, can he at least outline why he's not going to sign it, so that there's transparency and the public can at least understand it. So General Hara said that he was going to relay the concerns to the governor, and hopefully we can get some kind of response soon.
Well, the governor made it very clear last week that it's not going to happen. And that's why someone was just asking if you folks maybe, probably not
Mel.
you, Donovan.
Mel, can you ask
Yes.
Donovan? Some people are saying that he's in the dark; they cannot see him. He's almost invisible. Is there light?
Okay. I gotta go. I gotta move then.
What about what about the street light?
Wait, let me go.
The
Okay, let me-
Oh, real quick, let me backtrack. There is a question about the testing. If you test positive, that you need to have two negative tests afterwards. That is not true. I asked Dr. Green yesterday.
Oh, perfect.
In that question, I asked him, and he said, no. If you test positive, you go through your quarantine. Ooh, there he is, and then you're done. You're released. Obviously, if you're sick, then you go isolation. But as far as you don't get a negative, you're not required to get a negative test to go back into society. So I just wanted to, that question.
Okay,
just came up.
Mel, he's in the light now, but just the people gotta know this is Senator Donovan Dela Cruz. It's not the rock stunt double, okay? This is Senator Donovan Dela Cruz.
Yeah, right. Yeah.
All right. Okay. I know this is two of the top points. What is the plan for reopening the state? What does phase 2 look like for residents and businesses? And yeah, let's just start with those questions.
Well, the governor announced that he's going to have, he appointed Alan Oshima to develop, I guess, a plan and a strategy. There's a lot of efforts out there currently. There's Business Roundtable, there's different chambers of commerce, there's different nonprofits all trying to do their part. I think what the governor's people are going to do, Alan, is he's going to try to collect all that data, put it on a government website so everybody can see it and it can be transparent, and we can all, I guess, sing from the same sheet of music. But in my last conversation with him, I just tried to reiterate that, and I think Kauai would probably share the same sentiment, that I don't want it to be only a Honolulu-driven economic development plan. It has to be where neighbor island, rural Oahu, there are going to be some jobs and some incentives so that we can get the economy moving. Tourism, unfortunately, is going to take a long time for us to figure out how we're going to get that back to where it was. But there's other opportunities where we can get the economy moving, like in ag and hopefully manufacturing, energy, healthcare. And those are things that we got to start moving right away, get people working.
And at this point, what would seem logical, but we'll see what the work of the committee bears out, is that we would start to see businesses and some of the restaurants, things like that, perhaps reopening, but certainly to start welcoming visitors back. We need to be careful that we're not getting people coming from an area that still has the virus that's prevalent. And, so I just see it would probably be phased as far as how it all
Yeah.
works. The other thing that would not be unusual to being an island state, Kauai has taken some of the toughest actions as far as trying to contain the spread of the virus. And, it may well be that Kauai may be able to return to some level of normalcy sooner than Oahu, as large as Oahu is, and as difficult as it would be to contain Oahu. And, I shared with Alan after the press conference Wednesday, don't miss an opportunity to say the greatest economic recovery plan that we can implement is to have the least amount of spread of the coronavirus. When visitors start to make traveling choices again, they're going to want to go where it's safe. They would know
Yeah.
that we have available medical facilities, first-rate facilities, but most importantly, our system was not overtaxed and stretched and really, put on the brink of collapse. We had managed it well, and the spread wasn't as great. That would allow our businesses to open up locally for the residents first, and then when it's time for visitors to make that choice, they would pick us. It's interesting, after 9/11, when there was so much concern about traveling to some foreign destinations and the terrorist concerns, Hawaii became a point where a lot of people chose to vacation because it was the most exotic place that they could go to while still being in the United States of America, all of the security precautions that anywhere in the United States would have. And so, I do believe that by making sure we contain the spread is our best economic recovery plan.
There was a question about how do we isolate our island when this passes? And I think, Ron, you talk about Kauai being tough for early on, thanks to Mayor Kawakami and his administration. But as long as you have people, and I know we like to blame the tourists and the visitors, but if Kauai is isolated and we still accepting nothing against Honolulu people or Maui people or Big Island people, but if they're coming from a community that hasn't been isolated, that hasn't been cleaned out of this virus, then and we start opening things, then the chance of this community spread could be real. Now, we consider travel related as long as you got it from traveling, or you may have gotten it while you were traveling, or somebody traveled here and brought it. At the end of the day, every person gets this virus by a community spread. Someone passed this virus to you, but whether it was in a plane or in a foreign land. But until we get a handle of this thing statewide, as long as we have people coming into our island, no matter how good our numbers are, the risk is still there. And that's the balance, I think, this economic task force. Hopefully, there's a balance between the medical safety net and of course the economy, because there is a point that if we don't open up the counties, then the damage could be irreversible. So I don't know how we do that. Kauai is strict. We arrested 2 knuckleheads yesterday.
I thought it's COVIDiots.
Well, these beyond the COVIDiots, and I'll tell you why. They were stopped at the roadblock. See, now KPD sets up a roadblock at the airport. Everybody leaving the terminal, whether you're a private jet, Hawaiian, or whatever it is, you got to pass through the police roadblock. They were stopped at the roadblock. They took their information. They said they were staying at Princeville. They gave them the quarantine rules. You got to go to your hotel or to your accommodations, and you got to stay in there for 14 days. You cannot come out. They go to the traffic light. They turn left. Princeville is to the right. So the cops chase them, stop them, warn them again, second time. Turn this car around, you go to your hotel. They go to See, Kauai has a system now. They put everything in the system, so they have an idea of who the rental car, their license numbers. Anyway, they see the car at the Princeville Shopping Center parking lot. And they go there and they find this couple comes out of Foodland and they get arrested. See, there's knuckleheads. They had 2 warnings. But how long do we keep that going? At what point do we say, okay, we can ease off? But again, I was watching the news tonight and they're talking about Easter services on the mainland. There's several churches that are going to go forward. They're going to practice social distancing. But 2 churches on the mainland, and I didn't get the locations, 2 churches had clusters, 3 separate clusters pop up in the congregation because they were continuing to go to church. That's how terrible this virus is. So we got to be real careful when we start opening up because this virus is that contagious.
Yeah, and I don't know what the timeline is going to be because we don't know when it's actually going to get under control. So in the meantime, we got to look at diversifying the economy, going back to agriculture, healthcare, and we can leverage some of the federal dollars we're getting. We probably can take a lot of the risks that we've theoretically been trying to support and want for a long time, but now this forces us to have to do that, which I think is a good thing.
And I think we don't know per se what those industries are going to be, but nobody knew that the technology for screening and X-raying at the airports would be, in such demand. The whole Homeland Security TSA agents was nothing that we had ever experienced before, and ever since 9/11. That's all part of our daily lives, and certainly has created a tremendous amount of jobs in that security. So I see those things coming. Clearly, thermal scanners and things of that nature at the airport, and taking those temperatures, and to the day where somebody can manufacture enough of those tests. It's almost, if I were an airline, I wouldn't want a passenger getting on, possibly infecting other passengers and my employees who are manning the flight, that you got to take a test before you get on the plane to show you're negative, or on a cruise ship. And but I think that those are some of the possibilities of where we're going. One of the things Senator Dela Cruz and I are trying to work with, one of our, industrious, innovative employees. They would like to get a facility up to manufacture some of the PPE here in Hawaii. And her initial concern was that with the startup money to retool the factory, that it might be more expensive than what we could buy the PPE for today. And when Donovan and I got to talking, the thing that became obvious is that if we're making it here, if the state does a public-private partnership, then we ensure our own supply no matter what is happening anywhere else in the world. And then just this past week, we hear now the national stockpile is depleted. So we're back to competing with everybody, not just across the country, across the globe for this material. And so, we're hoping that we will see industries like that are going to ensure that, we're always going to have the necessary equipment that we need for all of our people here in Hawaii.
What are the chances? This is another question that keeps popping up. What are the chances of the state setting up a facility to quarantine visitors, local or resident? South Korea's program really works well, but what is, this is what a lot of people question, and I agree with them, is the quarantine system for a dog is quite, it's very strict, and it's not very complicated, right? You if you come, you want to bring a dog to Hawaii, you go to your vet on the mainland, you get a clearance, and I believe you can shave some time off of the quarantine, but they stay in a facility to make sure. And that's, I think, the challenging part is, okay, we have a lot of hotels that are not operating. There's a lot of facilities that could be used, government facilities, but I haven't heard anyone talk about that as a possibility. I still think we're on the start of the curve. I don't think we're anywhere near the top. But of course, I'm not a doctor or anything. But just based on the trends that I see across the country. But is that a possibility in any one of your opinions that maybe if it gets bad that we would be able to do something like that? That way, because this honor system isn't working. No, they did a new app apparently that they can log in and tell everybody where they're supposed to be. But is it a possibility that we could actually?
So my understanding is, yes, General Hara actually reported to the committee that that's something that they're actually looking at, where they would use a hotel and they would have National Guard securing it. So visitors would be that's where they would go.
Well, that's good to hear. That's good to hear. I'm not sure what the wait. I mean, I think we have so many of these guys that are floating around. I like the program where they're sending them back if they want to go back. I mean, can you imagine they gave a couple guy, they gave the first guy, they gave him an option to go back. They even offered to pay his way back, and he said no. He ended up getting arrested. And these are homeless people. But I'm just talking about the regular visitors that come here. See the social media that they're putting out there about how they're quarantining in paradise. That's what's drawing people here.
Yeah.
As we know, we saw the little increases in visitor arrivals, tourist arrivals last week.
But I also think what's changed that now that wasn't in place is Mayor Caldwell, Mayor Kawakami, and Mayor Victorino have all shut down vacation rentals.
Yeah.
And in the past, they would say, here's my address. This is where I'm going to be going. I have a place to stay. Now, those aren't supposed to be operating. So when you land, you have no place to stay. Then the option is we'll pay for your ticket to go back or you'll go to jail. And so we'll see if that, increases the impact. The other problem, and I was trying to work on it, Sukano was trying to office, but we still have rental agents who will not let people cancel their contracts. And they are holding them to the deposit and the money that they have contracted to pay. So now, in a few instances, these visitors are left with, do I just, shove the money down the drain, or do I take a chance that I'm not going to get sick and go to Hawaii because I paid all this money for this place to stay at and I'm not going to get it back?
What? Any of you answer this question. If you were in New York and it was $199 to get to Hawaii, wouldn't you go?
No. I tell you what, if Hawaii put out that we have a facility, it's not the Hilton Hawaiian Village.
I'm talking about how it is right now without the facility. I'm talking about right now.
Oh yeah. But like I was gonna say, Mel, if you broadcast that, we have a quarantine in a government-run facility, it's a hotel, but it's not the Hilton. You maybe put Akepo Arms, and you show something like Akepo Arms. I don't think people won't come. I'm gonna tell you that right now.
When the social media posts is of you in your little rooms and with the security or the National Guard outside, and you go back and say, "Gosh, boy, we made a mistake. We should have stayed home." I think some of them would actually turn around and go back home if they knew.
That's right. When we meet with the Attorney General, that's some of the questions we're going to ask her: is what other proclamation needs to be revised? Parts of the proclamation need to be revised so that they have enforcement powers to arrest people and say you're stuck in this quarantine station. Sorry, and then that way, National Guard or HPD or KPD can enforce it.
Yeah, well, I think the case law is going to start with Kauai's arrest of that homeless guy. That's I talked to the chief. That's how you establish case law, though. I mean, I think he violated the order. I agree with what the police did. I really do, and I think they stopped. The message is getting out slowly, but not quick enough. So anyway, we got a few minutes left. Open table, open forum. Anything you guys want to say, Senator Dela Cruz? Anything you want to say to everybody listening out there? This will be seen by thousands of people. So,
well, I hope people tune into the special committee, and if they have specific things that they want us to address, let the committee know, because we're more than happy to try to get more information out there. We've been getting a lot of comments saying that, you know, the senators actually get to ask a lot of follow-up questions. So that's where you get a lot more information. Unfortunately, I think at the governor's press conference, when they get a text from the media, the governor or any one of them can answer it, and then there's no follow-up. But at the committee, we can actually try to follow up. And you've seen some senators, they don't let it go until they get answers. And we just hope that that's going to be the place that we can get more information to the public.
Senator Dela Cruz, a question that I wanted to ask regarding the, you know, the budgets, grants and aids, nonprofit. Yeah. You know, with everything that's happening now, what's your take? How does that look? I mean, things is getting tight, definitely.
Yeah.
But
so that's a good question. That's a good question. So our budget is about $8 billion annually, right? $8 billion. So if Council of Revenues goes down 10%, negative 10% in tax collections, that's going to be a cut of somewhere between $700 and $800 million from the budget. So we're going to have to cut into the base. And that's for going all raises, all supplemental ads, all the teacher differential that probably wouldn't be on the table anymore. And we'd have to cut into the base. So we'd have to really focus on basic needs. That's where we're at. So we going back to the economy and making sure that we can diversify it and figure out how we can get spending up, you know, people working. That's the kind of effort we need so we can stabilize the budget and the economy.
But Charlie, I think it was the last time I was on, you know, as I mentioned, both the county and the state needs to adopt balanced budgets. And so if we don't have income coming in, then the hard question is, can we do the 20 million in capital improvement grants and aids for the nonprofits? Can we do the 10 million for the operational costs? And they're doing tremendous, great work in our community. Their donors are all going to be hurting for money as well. And so if that's something that we have to cut, but that comes at a high cost, I had shared that we were going to take the solar tax credit out, and we had so much pushback. One of the last things Senator Dela Cruz did before we recessed the session was restore the tax credit, but now can we afford that tax credit, you know, given the situation that we're in? And so there's only hard choices and harder choices that will be coming up for us. They're not going to be any easy choices or magic fixes for the kind of devastation we have, with one exception. The Governors Association put the letter out to the President and the Congress today. The Governor of Maryland is the head of the association, and Governor Cuomo of New York is, the second in their line. But they said they need $500 billion. In this first stimulus package that came out, the state of Hawaii and the counties will share $1.25 billion, but that is expressly clear that it can only be for COVID-19 related expenses. None of that says that you've got this huge hole in your budget because of the lost revenue. So you could make it up so that we could keep grants and aid and some of the other programs that are so worthwhile up and running, and it'll force us to make tougher choices. I know Nancy Pelosi and Chuck Schumer have said that they are trying to get more help to both the healthcare field as well as state and local governments. And if that comes through in some way, shape, or form, that would certainly be tremendous help to us and would allow us to really broaden the help that we can get to the residents here.
Yeah, sad state of affairs. I know it's tough. I like that how you reference it. It's going to be tough and tougher decisions to make. Somebody just asked about GET relief. I mean, I think I know the answer after listening to what you just said, but any possibility of general excise tax relief or postponements for the small businesses?
Well, they're
But
gonna, oh, go ahead.
no, go Donovan.
Well, taxation is actually delaying collection, but as far as any kind of waivers or relief for paying GET, I think that's going to be difficult.
Are you saying the deadlines have been delayed?
Yeah. So, yeah.
I
Oh.
don't know that they've announced anything on the GE quarterly payment. They only have pushed back the state income tax to line up with the federal income tax filing on July 20th. I haven't heard anything about deferring the quarterly payment yet. And that's due today. I called to leave a message with my CPA, and he actually answered the phone, whether he's call forwarding or because I'm worried about making my payment if it's going to be due on the 20th. And he didn't tell me, oh, don't worry about it. It's been deferred.
Yeah, it's been about 2 weeks since I've called the tax office, and I was told at that time that that was not going to be deferred or delayed. That deadline was not going to change. So
Well, we can ask DOTAX at the hearing.
yeah, I'm excited to watch your hearing, because that would be a question I would. I understand the state needs to generate the money, but you know, I understand a small business too that without the cash flow, having to come up with this payment to the state, you know, may be cause for that business to no longer exist. And I think that is, someone asked me to ask, at what point when do we get to that point of no return? Well, it's so hard to say, but for many people, that point has already come and their doors have closed. So
yeah, that's where we got to get the federal relief as soon as possible, right? So if we can get the federal relief to all those small businesses, then that's going to help much.
Right.
Much.
Got it.
So Mel, I just wanted to end on a happy note.
Okay.
You know, it was exciting to hear about the $1 million donation from the Chan Zuckerberg Foundation. Yesterday, 250,000 went to Wilcox Hospital, and 750,000 is in the Kauai Strong Fund. And so, as residents of Kauai, they wanted to be very clear that their money would be used to help the people of Kauai. I talked to my campaign treasurer today, and I think that I have maybe just under $3,000 that I could make in charitable donations. And I've instructed her on Monday to write a check for $3,000 or close to it to the Hawaii Community Foundation, to the Kauai Strong Fund. I think that that's the best place that my money could be used, and that'll zero out my campaign as far as charitable donations for the rest of the year. And I can't think of anywhere else that it would be better used, but through the Kauai Strong Fund with the Hawaii Community Foundation.
Okay. We got a question asking if you can repeat the hearings. I guess we got some of the viewers, they want that schedule again so they can tune in.
Okay, so you know what we'll do is we'll post it. It's going to be posted on our Senate website. So the Senate website will post the agendas, and for people who want to see, it's not just we don't just have the past meetings, all the correspondence that we send to the different departments and to the governor, we post it on the website, and then all the responses as well are all posted on there. So that way people can get all that.
And then Donovan and the committee write a summary of each of the meetings and responses, and then that summary is also sent to me and posted up.
I will post it on my Facebook page. If you can at all watch this thing live, it's worth your time. With Senator Mercado Kim and Senator Dela Cruz.
Senator Favela can get a little excited.
Yeah. So if you can, and I'll post it. I'll go get the website and post it up. And like Donovan says, you can look at all the testimonies. You can see it's a very informative website. So I'll make sure I get that up tonight.
And I would be remiss if I didn't acknowledge how excited Senator Keho Kalole got, on that whole about redeploying our employees. So Donovan picked a good committee. He identified who he had been talking to him and wanted to roll up their sleeves and get in there. And they've certainly done a great job. Senator Kidani as well.
I really enjoyed watching, and I really feel like when I watch the governor's press conference, I don't feel like I'm being part of the clique. But when I watch the Senate committee meetings, it's just different because you feel these guys and gals are asking the questions that you want to ask, and it's amazing. So we'll get that thing posted up. Anything else before we shut down?
So Donovan, you gotta watch till the end. Charlie and Mel are a little crazy.
Okay, I can't wait to see it.
And I'm gonna let Charlie. But before we do that, I really do want to say thanks, Donovan, for you and Ron to come on and again, invitation is open. If you guys ever want to share updates, something that you want out, please just let me know, and you guys are welcome to come on. We are taking a break, ladies and gentlemen. Tomorrow night there will be no discussion. It's Easter. We want to wish you guys all a happy Easter.
Happy Easter.
There will be no COVID discussion with Charlie and Mel. None tomorrow night. We're going to be all looking for our eggs. Okay. So Charlie, why don't you explain to the new viewers and to Senator Dela Cruz what we do and why we do it.
Well, first of all, I'd like to say to the viewers, keep on pushing forward. We want to flatten the curve. And with that said, for those who still don't believe about flattening the curve is a real deal, if we can't get the message out for you to flatten the curve, then what we're going to do is play a song for you that is so flat that you're going to help but not flatten the curve. Okay? And it goes
Charlie,
something like this. Okay.
Go ahead, start them off.
Yep. Okay, here we go.
Look at Donovan's face. Look at Donovan's face. Happy everybody. You guys have a good night. We love you guys. We'll see you guys.
Take care. Aloha.
We'll see you guys on Monday.
Good night.
Aloha, everybody.